You're likely familiar with the term ovulation, but do you know what superovulation is and how it works? That's what we're talking about today on Lunchtime Live at the Center. Dr. Lawrence Engmann is back here to discuss superovulation therapy. Welcome back, Dr. Engmann.
Thank you. Thank you for having me.
What's the difference between ovulation and superovulation?
So, so in a natural cycle, generally what happens is there's one follicle which is stimulated and develops, and then mid-cycle that follicle ruptures and releases one egg. So that's ovulation. It's natural. And then there's ovulation induction, where typically used for women who do not ovulate, and you give medication. And the idea is to stimulate the development of one follicle and the release of one egg.
Okay.
However, with super ovulation, basically what you want to do is you want more than one follicle developing. So you want multiple follicles and multiple release of eggs. So what happens is you're just rescuing some of the follicles that would have naturally died away, and then you rescue them to develop, and then mid-cycle you either give medication to release multiple eggs.
Is superovulation the same as controlled ovarian stimulation?
Yes, so it's the same as controlled ovarian hyperstimulation, and
Hyperstimulation.
yeah, which is usually used most of the time. You use injectables to stimulate multiple follicles, and it can be used for intrauterine insemination or in vitro fertilization.
And can you talk a little bit about what's happening in the body and maybe a little, the science around it?
So to understand what happens in the body, it's important to understand what happens during the natural cycle. So typically in a natural cycle, at the beginning of the period, there's a hormone which is released from the brain called follicle stimulating hormone. And basically, it does exactly what its name implies. It stimulates the follicles within the ovary. So the follicles are fluid-filled sacs within the ovary, and within the follicles are the eggs. So the follicle stimulating hormone, or FSH, stimulates those follicles to develop. So in a typical cycle, several follicles start to develop, and then one of those follicles become dominant, and that is what is released. So mid-cycle, estradiol levels go up, and then LH is released, the follicle ruptures, and then the egg is released. Now, the other follicles that were recruited but did not develop then die away naturally. So when you are giving injections or medications to stimulate multiple follicles to develop, basically what you're doing is actually rescuing some of those follicles that had been already recruited for that cycle that would ordinarily would have died away. Those are the ones that you rescue. So you have multiple follicles developing. So generally that's what happens.
I see.
Now, in superovulation, you're giving medications similar to FSH, which is released from the brain. So it can be in the form of injectables, and you can give FSH, follicle stimulating hormone, with or without luteinizing hormone, which is called LH. So when you do that, then so these are injectables you take every day from the beginning of the cycle, and then you rescue some of those follicles that would have died away. You can do the same thing using tablets, for example, Clomid or letrozole. They typically will stimulate one follicle to develop, but you could stimulate multiple follicles as well with Clomid and letrozole.
Okay. And so when exactly do you start taking these medications? At what part of the cycle do you do this?
So that's a good question. So the injectables typically started on the second day of the period, second or third day of the period. So typically, we will do an ultrasound and the blood work, and then start the injections that day. And the injections are usually every day. And then we do monitoring, which includes blood work, which measures estradiol, and also ultrasound to measure the size of the follicles as they develop. So that is with
Mm.
injectables. And then once the follicles are ready, have developed, typically you take a medication called a trigger medication, which is human chorionic gonadotropin (HCG), and that matures the eggs and ruptures the follicles in the case of intrauterine insemination. In the case of in vitro fertilization, you mature the eggs and then we do a retrieval a couple of days later. Um, if we're using tablets such as Clomid, that is usually started on the third day of the period for about 5 days or so.
And when you're doing monitoring, you can see the number of follicles then, and can you specify the ones you want to recruit?
Yes, when you're doing monitoring, you can see how many follicles are developing, and you can measure the size of the follicles. And also, you can measure estradiol levels. That gives you an idea as to how many follicles are developing. So, during an in vitro fertilization cycle, you can actually measure all the follicles that are
Mm.
developing, and you can tell which ones are matured and which ones are not matured, and that's what you use to determine whether things are ready for us to do a retrieval.
Okay. And you mentioned pills, you mentioned injectables. What types of side effects might occur with each of those?
So that's a good question. So the injectables, which are usually used preferably for superovulation, usually have a much better side effect profile. But some of the
Mm.
side effects include breast tenderness, abdominal bloating, occasionally ovarian hyperstimulation syndrome. So ovarian hyperstimulation syndrome is where there may be multiple follicles that may develop. The ovaries may get swollen. There may be fluid accumulation in the abdomen, and it could result in what we call hemoconcentration. That's a side effect that we don't want, and usually that's why we do monitoring to be
Mm.
able to adjust the dose of the medications and also make any changes to prevent hyperstimulation. The other side effect or complication with injectables is multiple pregnancy. So especially if we're doing injectables in IUI, because multiple follicles are developing and multiple eggs could be released, there's a higher risk of multiple pregnancy, which could be in the range of about 20-25%, depending on the age.
And that applies to both, say, Clomid and letrozole as well as the injectable ones.
No, no. With Clomid and letrozole, the multiple pregnancy rate is lower. It's about 5 to 8%,
Okay.
because most of the time you're not recruiting so many follicles. It's usually about 2 or 3 follicles uh, that you're recruiting. So the multiple pregnancy rate is lower. The side effects of Clomid, it's hot flashes, night sweats, mood swings, occurs in about 10 to 15% of patients. And
Hmm.
occasionally visual disturbances that happens less than 1% of the time. Um, Letrozole has a much better side effect profile, and it may cause some joint pains. One of the other side effects of Clomid is it may thin the lining of the uterus, and it
Oh.
may thicken the cervical mucus. Letrozole usually doesn't tend to do that.
And if you notice that the lining is thin, do you suggest taking something else, or would progesterone be offered for that?
No, 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 not necessarily. I mean, typically, if let's say you use Clomid and the endometrium is thin, we may switch to letrozole
Okay.
or switch to injectables.
Are these, assuming that the patient gets pregnant using superovulation therapy, are these medications safe
Yeah.
for that pregnancy and for the baby?
Yes, these medications are safe. Clomid and injectables are being used for a very long time, and there are no known effects on the baby. Now, letrozole, there was an abstract that was never published that suggested a higher risk of birth defects, but subsequent multiple studies have not shown that. So
Okay.
all those medications are safe in terms of the pregnancy.
Okay. And is it safe to say that the you would use letrozole and Clomid in IUI and the injectables in IVF, or do you also use injectables, or do you switch them around as well?
Yes, you can use clomid, letrozole, and injectables for IUI. Typically, we prefer using clomid and letrozole just because it's easier to manage the number of follicles that are recruited. So usually 2 or 3 follicles, and so the multiple pregnancy rate is lower. We do use injectables as well, but you
Okay.
have to be monitor carefully and use lower dosage to prevent multiple pregnancy and also to prevent hyperstillation. Injectables are mainly used for IVF because you can give a much higher dose, recruit multiple follicles, just because you're going to do aspiration of the eggs, so and fertilize them. So the aim will be to get multiple follicles and multiple eggs in order to be able to fertilize multiple eggs. But at
Excellent.
times we may add clomid and letrozole to the injectables for IVF as well. We have
Okay.
protocols that include clomid in addition to injectables for IVF.
So it just depends on the patient. It's very personalized.
Yes, it's very personalized. Depends on the patient's age, their ovarian reserve, BMI, previous cycles, and how they responded in the past.
Wonderful. Thank you, Dr. Engmann, for your time today. I appreciate your being here.
Thank you very much for having me. Thank you.
And wonderful. And thanks for joining us today. Be sure to check out our website at yukonfertility.com for any additional information or questions that you may have. And we'll see you next time on Lunchtime Live at the Center.
Thank
Take
you.
care.
Bye bye.